We'll just give it one more minute to wait for some folks, and then we'll be good. All right, I think we'll go ahead and get started. My name is Lex Owen. I work for the Nevada Center for Excellence in Disabilities Family Navigation Network, and I'm joined by my colleagues as well, which you'll hear from shortly. We'll introduce everybody as we get going. We really wanted to take this opportunity. We are a newly funded program in the state of Nevada, and so we wanted to kind of give you an introduction to us and our program, who we serve, and how we serve them. And we also want to take this opportunity to hear from you all. We want to hear from you all working with families and as family members yourselves, what is going on in the state, what you see as the most important issues for us to assist with and to kind of focus on as we get started on our work. So we are gonna get going here. So today we'll talk about who we are and what we do, and then we really want to give everybody a chance to introduce themselves and to also share with us what you see happening in the state for families of children and youth with special healthcare needs. And before we go on any further, I just want to kind of, many of us, we've been on Zoom a long time, but just a quick reminder related to Zoom access etiquette. Please say your name before speaking. And if you feel comfortable, please visually describe yourself. I'll visually describe myself. I'm a white woman. I'm wearing glasses and a black and white plaid top. This session is recording. You should have all gotten a automatic nice little Zoom box reminding you of that. Closed captions, actually the transcript will automatically appear. It should be visible for everyone. If you need that option and it's not visible for you, please let us know. Please send a chat to either myself or Marcia O'Malley if you have an access need. And then if you're comfortable, please include your preferred pronouns in your Zoom name. If you have any other access questions or needs, please let us know at any time. Or if we're talking too fast or using too many acronyms, let us know about that too. We want to make sure that this is accessible to everyone. So yeah. All right. I'm gonna pass it over to Diana Ravetti, who is gonna take us through our introductions.
Good morning, everyone. I would like to introduce our team to you today. We have 3 interns working on our project. We're really lucky to have them. Estefania, Eilish, and Michaela. They are not able to be here today because they're in class, but they're a very valuable part of our project and we wanted to introduce them. And then we're gonna have each of our staff members go ahead and introduce themselves, starting with Zach, and then we'll go down the list on the right of the slide. So Zach, I'm sorry, I forgot to describe myself. I'm a white woman, dark brown hair with a University of Nevada, Reno background that says College of Education, Human Development. All right, Zach, are you on here?
Yes, I'm so sorry for that. I just got back. Hello, my name is Zach Howarth. I am the admin for this project and for the family navigation. And I am very excited to be here and be working with everybody.
And hi, everyone. I'm Marcia O'Malley. I'm the Family Resource Coordinator with our new Family Navigation Network. And I am a white woman, gray hair, black glasses, and a turquoise blouse with an office background that's really mine. It's not fake.
And I'll go next. My name is Lex Owen. So I work for the NCED Family Navigation Network, and I also work as an assistant professor in the School of Social Work at UNR. I did introduce myself, or I did give my visual description, and I'm newer to Nevada, and I'm really happy to be here. And so I would love to kind of keep learning about the state and what's going on. So please reach out if you feel like you have important insight that I need to know. I really want to kind of take it all in like a sponge. And I will say Randall is not able to be here. Randall is the director of the Nevada Center for Excellence in Disabilities, and he also works on this project. And yeah, he was not able to be here this morning, but he co-directs the project with me. And then Diana, I'll send it back to you.
Okay, thank you, Lex. I did want to mention that Nevada is so lucky to have won over Randall and Lex, and we're super excited to have them in Nevada and working for our center. And they've already been making differences in Nevada, and you guys are going to love them when you meet them if you haven't already. So I wanted to say that. I'm Diana Rovetti. I work on a project on youth healthcare transition, and I'm super excited to start working on this. I'm going to be helping out the interns and family navigators. I'm a mother of a child with special healthcare needs. He's 23, so I feel somewhat experienced in this realm, and we're just really excited about the project. At this time, I would like to introduce everyone to Eric Jimenez. He works in the Nevada State Treasurer's Office, and he's going to talk to us just for a moment about the new grant for ABLE accounts in Nevada. So go ahead, Eric.
Thank you, Diana, and everyone on the call. My name's Eric Jimenez. I'm the Chief Deputy State Treasurer, which is a fancy way of saying that I help the Treasurer and the Governor out with a variety of economic recovery projects in the pandemic. It seems like it's been a long 16 months or so, but we've helped a lot of folks. I also run Nevada's ABLE account program. So thanks to all the work from NCED and all your help in talking to families. For those who don't know, ABLE accounts are a transformational vehicle for families and kids with disabilities to save without breaking Medicaid, Social Security, or housing assistance caps. So when we talk about benefits clips, ABLE accounts are a really useful resource to do that. I'm very excited because our office is taking the lead on getting feedback and spending the $6.7 billion with a B that we have in funding from the American Rescue Plan. And the first program we're going to launch for that, as someone with a disability, it's always near and dear to my heart. We're doing a $5 million program into ABLE accounts, which is the largest investment in ABLE accounts in the country, where we'll be providing $5,000 grants to families with kids with disabilities through an ABLE account. So we need all of your help in spreading the word. We have a commitment for an additional $5 million. So we're hopeful that we can help 2,000 kids with disabilities, and we'll give each of them $5,000 in an ABLE account. This program is going to launch in the next couple of weeks. So I'm happy to keep NCED and you all in the loop. It'll be called the TOTS grants. Transforming opportunities for toddlers and students. And like I said, it'll give $5,000 to families. It'll be about a 5-minute enrollment process. But we're really excited in one of the largest programs for kids with disabilities and making sure that they can save for a better future. So I promised I'd be quick, and I have to jump off in a few minutes, but if there's any questions, I'm happy to take them. And I will also put my email in the chat. And if you have any questions or want $5,000 for your kiddo, we're happy to make that happen. So thank you all so much for taking the time.
Wow, Eric, that's really exciting. Thank you for coming on and explaining that to us here today. I'm excited for that project to get started. All right, if you haven't already, we'd love to hear who's here. So if you could introduce yourself in the chat and including, where you work and what your position is. or if you're a parent, we'd love to hear from you also, and maybe how old your child is and child with special healthcare needs if you have one. So on to the next slide. Thanks, everyone.
Okay, so a little bit of background about us. Thanks, Diana, and thank you to Eric. I think he might have even had to jump off really fast, but more to come on that. It's a really exciting program, and if you have questions about that, feel free to reach out, of course, directly to Eric, but also feel free to reach out to us as well about that. We could get you hooked up with that for sure. We wanted to tell you a little bit about the background of the Family Navigation Network. So we are part of the Nevada Center for Excellence in Disabilities. This is a statewide center based at the University of Nevada, Reno, that serves the state through, we do trainings, research and dissemination related to all kinds of issues that matter to people with disabilities and their families. So we work across the lifespan, across issues. We're based in a school of education, but we do all kinds of work. As you heard Diana mention, she has a youth healthcare transition project, but she also does inclusive recreation and sports for people with disabilities. So we have all kinds of things. We also, if you're familiar, you may be familiar with positive behavioral interventions and supports based in schools, and the family program as well. So we have a number of programs. So we are all under that umbrella, and we're really excited to have this funding. We have a subaward from the state of Nevada Division of Public and Behavioral Health, part of that, the Title V block grant. And then we also have some funding from the Health Services and Resource Administration. So we're involved in a bunch of different things, and we hope to kind of bring that kind of the breadth and depth of our other work, our related work, to this focus as well. So I'm going to hand it over to Marcia to talk a little bit more about what we do.
Great. So generally speaking, this list tells you what we do, but I want to give you a little background. We are connected to a national network of family-to-family health information centers. Every state has one. Let's see, 5 territories, District of Columbia, and 3 tribal communities. So we're not doing this in isolation by any means. We have support and all sorts of great connections throughout the country. So we're all doing very similar things, but we customize them to our specific communities. So we're supporting families of children and youth with special healthcare needs as they seek healthcare. We help them navigate this crazy convoluted system that we have. We increase family and professional partnerships and alliances. Some of that is by training parents to understand how to better communicate to their medical providers. And some of that is actually partnering with medical professionals in our state. So we really provide a link to help initiate systems change to improve the quality of services. We improve care coordination, as I said, and then we work to improve healthcare outcomes and satisfaction, really working closely with families to help them understand the best steps to take, the best resources to use. So we're here as a general information and resource center around healthcare. And you want to go to the next slide there? Yeah, so what is unique about us? We are a family-centered and family-led project. That means that our staff and our interns too as well are either parents, like Diana and I both are parents of young men who have intellectual disabilities. Lex is a family member. Our interns are family members. So we're people who have walked the talk. We kind of know what we're doing now. And if we don't know, we've got a pretty good idea of where to look for the information. So, you know, you can trust that we have the experience and knowledge to be able to help and assist the families that come through our door. And we've got the time to listen to families. You know, this isn't a 5-minute medical exam. This is, you know, a parent talking to another parent. And we are here really to empower families to drive change. Change happens from the ground up. And when families identify issues and problems, we can work from that space and grow from there and hopefully make some change to help people moving forward. So we're here to build support networks where they're needed and to connect. We're connecting and connecting to existing efforts. So that's why we invited you all here. We want to find out more about what you're doing and how we might be able to partner. And now I think passing it back over to Lex.
Yeah, thank you, Marcia. This is Lex. Yeah, so Marcia touched on this a little bit, which is a great context in terms of our status as a family-to-family health information center. And so what we're doing is providing one-on-one family support. We have a phone number, a toll-free phone number that has Spanish and other language access. So yeah, we want to be linguistically, culturally, inclusive for sure. And so, yeah, so families can call this hotline. We also have, they can also contact us through an email address. We'll go over the contact info later, but really we want to make it as easy as possible for families to get to us. And if you are a professional, we need your help making sure that families know we're around and they know what we do. Many of you may have received emails from our intern Eilish yesterday, asking, letting you know about what we're doing, and then we're open to coming and doing some in-services or presentations if that would be helpful. We just want to make sure that we're getting that word out to families so that they can contact us when they need help. We also are in the process of developing family-centered trainings on healthcare navigation. So really, we know that healthcare systems navigation can be a real maze, and it can be a real headache for families, right? These are families that are interacting with the healthcare system, more than kind of the average family. And so with that comes more, funding issues, time spent at doctor's offices. A lot of challenges can come up, especially for families who may have less resources, live in rural counties, things like that. So we want to make sure that we are including the entire state in our work. And then the third way we do this is through collaboration with partners. So, invitations like this, getting to know one another and talk to one another as we're engaging in this work. We really want to collaborate with, as we said on the previous slide, what's already happening, right? What are already the good things that are going on in the state, and how can we support the work that you all are doing and continue to partner with you. So please reach out to us. We really want to collaborate in making the state in making systems work better for families of children with special healthcare needs and disabilities. Okay, so I'm gonna send it back to Diana, and she's gonna talk a little bit more in detail about the things that we help with.
Absolutely, thanks, Lex. Well, those of you who know me know that I have a son, he has Down syndrome, and one of the best things that happened to me right after I had Jack was that I met Mary Bryant, and she was working for early intervention at the time, and she's to this day still a good friend. We went through partners in policymaking together, and we worked together, but from that moment it became very apparent to me that peer-to-peer support was really, really important. And I've looked to Mary since my son was born for support and guidance, and we want to be that for other families as well. Since having my son, one of my favorite things to do has been visiting with new parents that have a baby with Down syndrome. And so this project is a dream come true for me, that I get to make that my work. And so we're really excited to help families navigate through the system. And one of the things that we're going to be working on is helping families apply for Medicaid and CHIP. And recently I had the pleasure of helping a Spanish-speaking family apply for Medicaid. They were accepted, then they were denied, and then we said, okay, well now we have to apply for Katie Beckett, so we were helping with that. And I'll tell you, it's not easy. And being someone who speaks Spanish, I think that made it a little bit more difficult as well. We have translators available that when I was meeting with the family, I had a translator with me, and we make a really nice bond with the families and are there for them. And hopefully they feel comfortable reaching out to us for, the resources that they need. I also helped with her supplemental security SSI application, which those are all kind of difficult and a lot of things a lot of moving parts, as most of you all already know. We're going to be providing information and referrals for community support programs, also healthcare and service providers. We're working on many different kinds of lists according to the needs that are in our state, and we're really excited about that. One thing that just came up, a family needed some support or help finding low-cost speech therapy services. And so we just sent out information on that, and we're helping them get hooked up for that for their child. We're going to be helping with family-centered healthcare decision-making. We recently had a project on supported decision-making. We believe in that. We believe in families having a say in, all of their healthcare decisions, and as well as the youth as they transition. That leads on to my next bullet point, youth healthcare transition. That is transitioning young adults or soon to be young adults from pediatric to adult healthcare system. So a lot of times in this state, I don't know what your guys' experiences are, but my experience was that the pediatrician said, oh, you could just stay here forever. But then my son got sick of being in the waiting room with all the little toys. And so that's when we decided to move to adult healthcare. But also we're educating medical providers on youth healthcare transition because they don't really know what to do, or that it's a thing. And I know that it is one of the priorities of our maternal child adolescent health program under children, youth, special healthcare needs. And so we think that it's really important. And we're there as a resource for families during this process. We've done some research and sure to do more on financing options for healthcare. We recently helped a family find some resources to pay for some orthodontics, and it's going to be depending on what the needs are in our state. And of course, we can't cover everything on this slide, but we're really excited about it. And of course, our peer support. I talked about that already a little bit, but we do think that that's really, really important. And all the people that are going to be supporting the families, like Lex said, have already been on this path before. And so we hope that we can be a kind and empathetic listening ear and provide resources to these families. How can you guys find us? Well, we have a page on the university website. You see it listed above. And Marcia, can you put that in the chat so they can just click on it? Maybe that'd be easier. We have a toll-free number. It's staffed 8 to 5 every day. And then we have an email address that comes to our team that's listed on the slide as well. We have an online intake form that we're going to be having up on we're just waiting for our web developer to get that up on our website as well. So people don't even have to call or email. They can just do it right on our website. And then we will contact them with the information that they need.
Great. This is Lex. Diana, thank you so much. That was really helpful. So we want to hear from you. We have a few kind of questions that we'd love to kind of get your take on, your insight on. But first, I'm wondering if there's any questions about what we just covered. We just kind of did a quick overview, but wanted to see if there's any specific questions. Feel free to shout it out or to use the chat. Let me know if there's any of those, but I will also move on to our first kind of general question, which is, what are you hearing from families? Or if you are a family member, what's going on for you? Are there any pressing issues or common themes that you see if you are working with families? Anyone have anything that they would like to share related to this?
Hi, my name is Shannon. I'm a family member. I have a medically fragile kid with mental health issues. can somebody see why it is so hard to get meds? You know, we've been having meds. We have a lot of psychiatric meds that change routinely. And we've been fighting for 3 weeks again between the pharmacy, Medicaid. And it is very frustrating. We went last year like 6 months before we got it straight. So in the 6 months, he has no psych meds, which just spirals us out of control. And it is a problem.
This is Lex. Shannon, thank you so much. I really appreciate that. And I'm wondering, we would love to follow up with you as well, and hear more and see if there's any way that we can help further, but appreciate you bringing up that issue for sure. Thank you.
Lex, can I just add one thing really quick? Shannon, can you tell us, is it because of the doctor's offices or the Medicaid's not paying, or is there any specific reason why it's, can you tell us just a little bit more?
Okay, it's been on and off. And last year we finally got our SSI after 4 years of fighting with them on my own. This all, everything, every service I have fought for 11 years to get him. But I sat in the doctor's office 3 weeks ago today, watched him send the PAR in, and I have been fighting. We finally got his new med yesterday. And CVS just tells us, oh, it's not there. Medicaid had it blocked for some reason in their system. They swapped me insurances again. When we went to SSI, they took us off of fee for service, which we'd always been on, put us on HHP. I pitched a fit because they don't pay for anything. They put us on Anthem. Then they dropped us off of that this June, and put us back on fee for service. So to deal with them is just impossible as a family member.
So it sounds like it's a insurance / Medicaid / payment. Yeah, that sounds horrible. Thank you very much for sharing that.
Other things that you are hearing or seeing or experiencing that you think it's really important for us to know about, and to maybe try to address, or to just kind of have a sense of what's happening?
So this is Stephanie Versnick with Nevada PEP. And some of our families, because as everybody knows, Nevada doesn't have a lot of specialty doctors, and many of our families go out of state. Do you guys assist with those resources for those families?
To go for out of state travel? Is that what you're talking about, Stephanie?
Mm-hmm.
Potentially, that's something we could. I don't know that we have the direct ability to financially support, but we could definitely help in trying to find to get access to resources like that for sure. So we'd definitely be willing to work with folks on that.
Thank you.
And Dr. Owen, this is Vicki Ives from Division of Public and Behavioral Health. Just wanted to call out the medical home portal resource, which you all will be helping with trainings, and we can as well on utilization of the portal. They do have national resources and out-of-state resources that might potentially be helpful. But thank you.
Yeah, thank you, Vicki. I appreciate that. And Marcia, maybe if you could put a link to the medical home portal in the chat, that would be awesome. And we can, yeah, we definitely want to let folks know about that. Is that okay, Marcia? Sorry.
I'm
Marcia's chat's not working, but I'll put it in there.
Oh, okay. Okay. Yeah, appreciate it. Sorry, Marcia. Thanks, Vicki. Appreciate that.
Hi, this is Rachel. I'm the health equity manager at Anthem Medicaid. You know, in regards to I am a white woman, brown hair, in a ponytail with glasses. In regards to the transportation or the out-of-state stuff, MTM, they do have services where you could get potentially get like a food benefit, lodging, mileage reimbursement. I mean, I know that it's probably, again, it's another task that's difficult sometimes to maneuver, but they do have that that option if you are forced to go out of state.
Thanks, Rachel. I appreciate that. And this is Lex. I'm going to move on to this next question, which I guess is similar in some ways, but thinking about, specifically in navigating systems, what issues do you think are most important to address there? And, if Rachel, I don't want to put you on the spot, but as someone who works in the healthcare system, wondering if you have any insight on this as well from kind of a, the organizational level perspective, but yeah, open to everyone thinking about, what are those issues? Maybe it is, out of state, travel to medical appointments. Anything else that you would add there?
Yes, hi, Rachel again. So, one thing I think across the board that we continually hear, even though, like I said, MTM is an option, transportation is always just number one for people. MTM is a benefit under Medicaid. However, it's only for medical transport. So if you need to get to the grocery store, or you need to get to WIC, or you need to get, just anything really that's outside of that realm, that's a barrier for people. Truly. So that's one thing that, and then just like, I forgot her name. She was talking earlier about kind of being switched with health plans. That's very frustrating. There's no consistency. And if they were with Anthem, I would get you connected straight away with one of our Anthem case managers. We have case managers, they specifically work with children with special health care needs. So I can see how frustrating that is within our system. And each, like Medicaid, when you have your MCOs, we don't control when people are switched off. We have nothing to do with that. That's state level stuff. So I'm sorry that that's happening. That's unfortunate. But I would say transportation.
Yeah, non-medical transportation. Right. Yeah. Thanks, Rachel. Appreciate it.
Lex, there are several questions in the chat box. Would you like me to read those to you?
Yeah, if you would, that'd be awesome.
Okay. Carlo said, do you have any resources for families with children who are undocumented for healthcare? I have a 2-year-old who was born outside the US who has cancer and the family can't get assistance.
Yeah, that's definitely something we can help with. So I'm wondering if there's a way, if we can put maybe just our email address in there, we can definitely interface, after this call, or you can give, or if you want to, Carlo, give your contact info, or just, send it to one of us directly. We can definitely, help with that.
All right, great. And Cheryl asked, what is the age range / population you are serving? I know you're trying to reach out statewide, but can families age out of your services?
So yeah, that's a great question. Thank you. This is Lex. We serve the children and youth with special healthcare needs designation is 0 is birth to 22 or 22, 21, 22. It depends. Yeah. So that is our target population in terms of the individuals that we are serving. And then obviously also, family members who are supporting those individuals, obviously, would be across the lifespan. But I think the other thing is that, we're very conscious of the, the kind of transition cliff and trying to avoid that. And so we would obviously, want to do that warm handoff in terms of, working with, one of the things that we would like to do is work closely with the regional centers to make sure that we are facilitating a smooth transition related to healthcare, transition and navigating those changes. So yeah, definitely. But if you have, if you have questions kind of across the lifespan, we are glad to use kind of the broader umbrella of the NCED, which is definitely, lifespan oriented. So, but yeah, definitely our focus is, 0 to 22, if that makes sense. Thanks, Cheryl. That question.
Okay, great. We had a couple of comments regarding the last slide. And one says families are struggling to get doctor ordered genetic testing paid for or covered by insurance, both private and Medicaid and waivers.
Great.
And then,
sorry,
ahead.
can I just say one thing? I think we have Hannah Barnhart who's on the call. So she's the genetic navigator for the state of Nevada. Hannah, I don't want to put you on the spot, but I'm wondering if you are on, if you would introduce yourself so that folks know you, if you are able.
Yeah, thank you, Lex. And sorry for the late kind of join in. My internet is really slow, so I can't do video, unfortunately. And yes, so I'm the new Nevada genetics navigators, and basically I have an MOU with the Mountain States Regional Genetics Network, and my main role with them is to help the families who need to navigate genetics in Nevada. And I think I saw someone asking or kind of commenting, I think it was Cheryl, saying families having a horrible experience with medical professionals because of their child's differences, and what assistance or training for professionals. One thing that we're doing right now with MSRGN is what we call Time for Genetics. And what it is to help professionals, and it's geared towards primary care physician's office or pediatrics, so that they can sort of, understand what is entailed with genetics, genetic testing, how to start the referral process, that kind of thing. And I mean, some providers, they might have done a rotation with genetics, but it's been a long time ago. So they kind of need a refresher on what genetics is about. So that's definitely a program that we're running right now that we can, I think Christy's on as well. And she's the one person that I work with, and I can put it on the chat that you guys can apply for that. I don't know if there are any pediatrics or primary care physicians offices on the call right now, but you can apply for it and you guys can get to know what our program is about. And then I'll also put on the chat my email that you guys can contact me directly. And again, if you guys know of family members or patients themselves that are experiencing kind of that barrier on how to find those services for genetics, I'm your go-to girl, I guess, for Nevada. Thank you, Lex.
This is Lex. Hannah, thank you so much. And yeah, and so the question about, getting genetic testing paid for, we could definitely, help with that and interface with Hannah and Christy on that to work on that. So that's definitely something that, we could talk through further. So yeah. Diana, sorry, I cut you off before. Were there other things that we should shout out from the chat? And the other thing is, if we're not able to get to everything today, we're happy to send out kind of a fuller explanation, a summary of everything that was mentioned in the call, including all the resources. So, never fear related to that. But Diana, I don't know if you wanted to.
Yes,
shout
I
out
did. The next question, it says, too many families are not eligible for Medicaid. They may or may not have health insurance. Are you able to help those who do not qualify for government assistance?
Definitely. Yeah. So we serve everyone regardless of insurance status. And so we would love to work with you to try to figure out, to try to troubleshoot some options. I know, obviously some of those issues might be beyond, our capabilities, but definitely we want to be able to know about those and kind of keep tracking those so we can just keep working towards, reforming that. Yeah, for sure.
All right, and it says also how to find medical professionals who have experience with people with special needs.
This is Lex. That's another thing that we can definitely help with. Right now, we're compiling not only lists of medical, dental, and kind of other, mental health and kind of other therapeutic providers, but also trying to get a sense of who are the quote unquote, disability friendly providers. So those are, those kind of lists are a little bit harder to find, but really wanted to kind of using our kind of built-in knowledge of, our experiential knowledge, and also reaching out to, other families and professionals. We definitely want to get a sense of that. So, it's hard to, do that on this call, but definitely please follow up with us, shoot us an email or give us a call. And that's definitely something that we can help you with.
Okay, and Delisa mentioned there's also a DACA social worker at UNR that may be helpful. Her name is Janet Najera, for information for everyone. And then
yeah, okay.
one person, Cheryl would like us to share our mission/vision for our organization and how our services will be promoted.
Say the question one more time.
The mission and vision for your organization and how your services will be promoted.
Yeah, so definitely our vision is that families of children and youth with special healthcare needs will have increased access to healthcare services, and that they will have increased satisfaction related to those healthcare experiences. So that includes, of course, outcomes for individuals, for children and youth with special healthcare needs, but it also includes kind of overall a sense of, familial well-being, right? In terms of, so we're thinking about things like decreasing that unmet need level, right? We're also interested in thinking about, what is the sense of, there are ways to measure, for instance, things like shared decision making. There are ways to measure the extent to which families are, engaged in their healthcare, and that they feel like that, their experiences are taken seriously, their concerns are, both kind of their strengths and challenges are heard by their providers. So that is our overall vision for our work. And so really our mission is to do that by some of the things that we've laid out here previously in the webinar. But yeah, and then in terms of how we will get the word out, so this is one way. The other, we are doing targeted outreach to provider agencies and other state entities. So like I said, we sent out a boatload of emails recently, specifically to certain folks, but please, we would love it if you can pass us on to other professionals, but also families. We really want to, I'm thinking about, we of course want to reach out to families that are already deeply entrenched in these systems, but we're also thinking about the folks who are not yet connected to these systems and how we might interface with them and get them connected, right? So for some, thinking about, the family with a prenatal diagnosis, or, who has just had a baby or things like that, or a late diagnosis of autism, right? That, getting folks connected with that. So yeah, does that help? Does that kind of answer the question? And Marcia and Diana, feel free to jump in there too.
Yeah, Marcia mentioned that we're also using Facebook and LinkedIn for outreach. We have some other social media channels as well. We have an email list that we're sending to. We're trying to, increase the capacity of that as well. But also we're going to be visiting providers, agencies, so that they know about us, so that they can tell their families about us as far as our outreach goes. And we had someone asking about our office hours. They want clarity on the expectations of the phones being answered. Said that I mentioned that staff from 8 to 5. Is this daily or Monday through Friday? I recently called during work week hours and got the recording, perhaps due to the air quality in UNR was closed. Informing us all on clarity would help.
Sure. Yeah, this is Lex. So yeah, the phones are staffed from 8 to 5. Definitely, if someone like steps away from the phone, unfortunately, if you are able to leave a message, that's really helpful. the phones are staffed from 8 to 5 Monday through Friday. And so then our policy is that you would get a call back with, if you call over the weekend, you would get a call back within 2 business days of if it's without business days. So yeah, for sure. But yeah, ideally, it would be staffed 24/7, but we're not able to do that. But please, when you call, do leave a message. That gets immediately, if for whatever reason no one is, unfortunately attending that phone at that moment, those emails get forwarded directly to our shared email address. So we should have, you should expect a call back very quickly.
Yeah, our voice messages are transcribed, and so we get them right away. Even if one of our interns or someone's not at that desk, if you left a message, then it would come directly into our email inbox. So that's why we'd really like people to leave messages, and then we plan to be as responsive as possible. Hopefully within the day, but like Lex said, for sure within 2 days, and we have several of us working on retrieving those messages and everything. I don't think there were any more questions in the chat.
Okay. I wanted to ask this question. What's working well? If you are a family member, please feel free to chime in, or if you work with families, what do you see that is working, is working pretty well, that there's room to kind of capitalize on that, or to programs that are maybe in one county and that could be extended elsewhere, things like that. Would love to hear if you have any ideas on that.
We had one comment regarding that last slide, and it's what's working well is telehealth for my son's nutrition appointments. Well, that sounds really good.
That's awesome. That's great to hear.
Also, a new question came up. Are you replicating any projects / pilots from other family-to-family programs?
Yeah, that's a great question. Thank you. This is Lex. Yeah, so that is our intention, definitely. One of the things that we've been thinking about is, well, there's 2 things that are kind of on the horizon. The first is that we have been in conversation with Parent to Parent USA. So this is a related model that is just based on peer support on that matching. So what Diana was mentioning earlier in terms of that, one-to-one peer support that, is a little bit more dispersed in terms of, having that volunteer capacity. So that's something that we are pursuing, getting involved with them. And then the other thing is to think about our family navigator staff training, and to think about there are some kind of promising training interventions that I think could use some further testing. So we want to make sure that the folks in those positions, those family navigator positions, are really well positioned to be doing that work, right? That they're really knowledgeable, not only about kind of policies and services and resources, but also that they are able to bring an empathy, active listening skills, things like that, that really make them effective workers with other parents. So yeah, definitely interested in pursuing more of those. So if you have ideas, let us know.
Hey Lex, I got an email asking, will there be a replay that I could watch? I had to run to the doctor.
Yes, this is recorded, and we will definitely send the recording out, and we'll also post it hopefully on our website or elsewhere, either on our social media. But yes, we'll definitely make this recording available, and also provide kind of a rundown of the resources that were mentioned here, which I think were really helpful. So again, thinking about, what could be better, but also specifically, how can we be a bridge or a link across systems? So, where are the places that we can, again, just work to kind of be a go-between or a liaison between parents and professionals, but also across, between professionals to professionals, agency to agency. We're really interested in doing that work as well. Any ideas or thoughts you may have on that?
Hey, Lex, while we're waiting for a response on that, we had one more question, and that was, what person/family-centered practices are you employing in your navigator services? Will you be collecting data?
Yeah, that's a great question. So as part of our parent navigator training, we're employing the Strengthening Families curriculum, which is an evidence-based training curriculum. It was actually designed for families who are at higher risk for being associated with the child welfare system. But the thing that I really like about it, and a lot of other family-to-family health information centers utilize this training as well, is that it's really focused on empowering families, right? That it's really trying to provide assistance, information, referrals, support, yes, but also really trying to capitalize on the existing strengths of the family, understanding the dynamics within those families, and then really trying to build kind of it really takes a coaching mentality where it's not it's not us telling families what to do, right? It's really us guiding and taking a kind of guiding inquiry coaching approach with families that really puts the family at the center in terms of them thinking about what do they want for their lives, right? What does that person with a disability, what does that child or youth with a special healthcare need, what are they looking for to make their life better, to improve that quality of life, and to then think, okay, how can we help them get there? Or what do they need, in their own lives? What kind of skills might they need to help them get to that next level? So really kind of using that motivational interviewing approach. The other thing is, we are really interested in making sure that the support that we're providing is person-centered in terms of making sure that the child or the youth with the special healthcare need is really at the center of that. So a number of our staff have been trained in person-centered planning approaches, things like maps, mapping and planning, really thinking about, how do we make sure that those folks are at the center of this work. I don't know, Marcia or Diana, if you wanted to add to any of that.
No, but did you answer, will you be collecting data?
Oh, we will be collecting data. We are required to report, de-identified demographic data to our funders. But we are really interested in kind of evaluating both the process of our work and then, of course, the outcomes. So we'll be building in some of the kind of measures and metrics I mentioned earlier in terms of related to kind of our mission and vision. We're definitely tracking that, thinking about really wanting to make sure that we are reaching as many children, youth with special healthcare needs, reaching as many families as possible. So and the other thing that I am really interested in doing is hearing more from families and really getting a sense. So we would also eventually hope to build out doing some focus groups for family, really getting a sense of, what is life like as a parent of a child or youth with special healthcare needs, what is really going on. But in addition, I think dialogues among families and professionals, I think that's something that we could also facilitate. Family Voices, which is the national organization for the health, the family-to-family health information centers, they provide a really nice structure for an intervention that really tries to increase family engagement in healthcare settings. And so that's something that we could definitely pursue for sure.
We had another question. Can you work with families across the state, northern and southern Nevada?
Yes, this is Lex. For sure, we are statewide. We want to work in the north, in the south, and of course in the rural counties. So yeah, so we right now are, so I should have put this on the slide, but we are hiring family navigators. So if you are a parent and you would like to play this role, we are hiring part-time positions, and we're specifically looking for folks in the south and in rural counties. So please reach out to me. I'll put my email in the chat in just 1 second. Or you can reach out to any of us, really, Marcia or Diana or myself, and let us know. And we would love to talk to you about that further. We can send you the job description as well. Yeah, so that was a long way of saying we are for sure statewide, and we really are committed to that. And yeah, if there's ways that we can to improve on that and do that better, we want to know. So please reach out to us if you have ideas about that.
And I think Lex kind of already answered this, but it says Nevada is very rural and minimal resources available. Do you have a plan to network and connect with the rurals?
Yeah, so definitely want to try to make the use of teleservices to the extent that we can. Also reaching out to places like family resource centers in rural counties and connecting with them, making sure that we have all the knowledge that is available to us in the rural counties for sure. So yeah, it's for sure a challenge, and yeah, we want to work on it for sure.
Yes, and if you know any parents in the rurals who would be interested in being the family navigators, please share that information with us, as well as Las Vegas.
And I just want to say too, I think we're in the position of we're doing kind of at the micro interpersonal level, right? We're supporting, we're talking to folks, talking to family members and parents, and we also want to work for systems change, right? And so we're trying to do both at the same time. And so many of you are I'm preaching to the choir here, you all are engaged in that work already, but just to think about, we really have a strategy of trying to improve healthcare access and quality for families of children, youth with special healthcare needs at kind of every level. And so thinking about the best ways to do that, and certainly we want to partner with you as you all are engaged in that work as well. We're almost at time. I don't know if there's any one last burning question, Diana, that you want to grab, but I want to end on time and be respectful of folks' time, and really thank you all for coming today and participating. Please, I think there's been definitely a lot of great things generated in terms of questions and ideas and comments. So please keep them coming. We're open, we're open for business, and we're open to your thoughts and ideas. We really see ourselves as kind of, an additional component in the state that we want to, build on and work with and link into other places that are doing this work. So yeah, with that, I will say goodbye, and we hope to be in.
One last thing, Lex.
Yeah.
Hey, Lex. Can we email the information pertaining to the positions for the rural area? And what are we going to be emailing all the participants out something?
Yeah, happy to send everyone who registered the recording, and then also the notes as well. Yeah, happy to do that. Great. Thank you all.